Hello everyone, today we are going to be demonstrating microneedling on our lovely patient here, Clarissa. So microneedling, some of the benefits that are included is to help target pigmentation. It helps soften fine lines and wrinkles. It helps with your skin elasticity. It is also great for acne scarring as well. What really happens is we're getting that collagen stimulation going so that her skin just looks tighter, brighter, more youthful, and more even in tone. So here kind of seeing a close up on what happens during a microneedling treatment. Like the name says, there are these micro needles in the pen, and so it creates these micro injuries that help promote your body from healing and stimulating that collagen production. You can see here that she's getting a little pink and red, and sometimes when we're a little bit more aggressive, you can notice some pinpoint bleeding. We might get to that point. Every patient, it does kind of vary. Typical reaction on how you're gonna look after the treatment, you'll see how Clarissa looks, but usually it's like a bad sunburn. So redness, some irritation. Throughout the week, she'll notice that she's a little bit dry, flaky, and peely. Because she's younger, she's probably gonna bounce back a little bit quicker, and by the end of the week, she might be pretty much back to normal. Usually we say if you have any special occasion, it is best to do this treatment 2 weeks before, so that if you are a little bit more sensitive and it's taking you a little bit longer to heal, by that 2-week mark, you're pretty much good to go. And then you kind of just get close to it. So Clarissa, how would you say from a scale of 1 to 10 the discomfort?
Not too much, maybe like a 4.
A 4?
Or 3.
Okay.
But not much.
Not
even
too much
that.
bad.
Yeah.
So we did apply some topical numbing prior to the treatment. So it kind of just dulls any pain and discomfort. Some people don't feel anything at all and they just take like a little nap. But that numbing definitely helps. So we're glad to hear it's about a 3 or a 4 for Clarissa. Still gonna do it? Clarissa already has beautiful skin. It's very clear. You can kind of see a little bit of some pigmentation, probably from some breakouts previously. Not much textural, very, very mild on her. So this treatment is going to yield really great results even after 1. But we're really going to focus on those areas, and with each area we can hit a little harder if need be and be a little bit more gentle in other areas that don't need it so much. I do know after talking to Clarissa during her consultation that her jawline tends to get the most breakouts, so we're going to really focus there to make sure that any residual pigmentation or textural problems from those acne is really targeted and treated. So Karina here is going to be also targeting the neck. We love bringing down any of our treatments down to the neck area just because we want to have all those anti-aging benefits there as well. Sometimes it gets forgotten. We have other great treatments that we love to suggest more so for skin tightening, but she'll still see that plumpness and that tightness and that skin elasticity improve in that area as well, just with the microneedling.
I'm gonna get your nose good.
So before your microneedling service, there's a few things that we like to make sure that patients know to do prior. One is just drinking lots of water to help promote a faster healing. Minimize your sun exposure not only after but before your treatment as well, so that we can make sure that your skin's in tip-top shape. And then we also suggest to discontinue any exfoliants such as like tretinoin or retinol, products like that could kind of further irritate the skin. So discontinuing the use of those products at least 3 days prior is always suggested. You don't want to do any other skin services such as lasers or radio frequency treatments or even like waxing, because again, we want to make sure that the skin is in good shape and that she doesn't get any more irritation than she needs to. So for aftercare with microneedling, it is pretty simple. You just want to do a gentle cleanser. At Radiant 360, we carry our ZO brand, so we really like their gentle cleanser. It doesn't irritate the skin, especially post-procedure. So just cleansing. She doesn't need to cleanse the night of because we are going to apply some great products afterwards, which her skin is craving. So she's not going to cleanse the night of, but the next morning, a gentle cleanser, a good moisturizer. She can always put in a little bit of growth factor in between, but she's going to be really, really, really good. Really good with her sunscreen. Just while your skin is healing, that sunscreen is going to be a good protective and make sure that she doesn't get any pigmentation after the treatment. So refrain from any strenuous activity for the next 24 hours because your skin is already inflamed and you just kind of don't want to do that any further. And then sun protection. So minimizing that overall sun exposure for the next week or so, and then just being very routine with your sunscreen application. So we are pretty much done with the microneedling treatment, and now we love to finish off our treatments with the growth factor from ZO because right now her skin is craving anything. So as soon as you put that on, that skin is really going to absorb it really well, and so she's going to get the most benefits of this product right now. We do always suggest our patients to, if they can, also get a growth factor with it and apply it while they're healing. It's going to promote a faster healing as well as boosting the effectiveness of her treatment.